Suicide prevention has grown enormously in the last 17 years. For the first time, we have federal appropriations. Many states have a state suicide prevention plan. We have a national plan that guides our efforts here in the United States. And we have a wonderful public-private partnership that brought together members of the private sector, the public sector, and the philanthropic sector to help us advance objectives that we all believe will truly make a difference and end this burden of suicide to the greatest degree humanly possible. So because of that, there's a lot of momentum, people are prepared, and there's an infrastructure today that didn't really exist in the past. Many, many people are committed to trying to do what they can to reduce the burden of suicide in their community. Because we are being very honest with where we are in the field, we see the burden continue to exist. We have to look at new ways and new approaches to complement the approaches that we've discovered thus far. I think it's incredibly important that we make sure that the clinical workforce is well trained, that there's an adequate workforce in size, geographically dispersed around the country for those in need, and certainly one that is competent and capable, working in systems that know how to care deeply for the patients who walk through their door. I feel very strongly that we should make sure every door is the right door for a person who struggles. It's just not sufficient. If you have someone you love, to not know where to take them, and if you do take them somewhere, to not have a strong confidence that they're going to get the kind of care they deserve to get on the path to recover that we all hope for. But having said that, that's not enough. Yes, we have to think about mental health, but yes, we also have to think of public health approaches. How can we reach people in populations at risk by thinking about settings where we might find individuals at risk that we haven't really looked at before, and engaging partners that could join us in this effort? We just have to look through a lens much broader than just mental health, but we have to think about community health, family health. We have to think about societal health and making sure we do our part as a society to make sure that those in this society who are experiencing transitions do so with the confidence that they're cared about, and that we have a comprehensive suicide prevention program that's based on what we know and applies strategies that can really make a difference for those who are experiencing tough times. I think that to do anything less is insufficient, and I think as a national community who 20 years ago we barely uttered the word suicide or suicide prevention, today we have mobilized a workforce, we've mobilized the nation, we have states and tribes and campuses and territories doing so much, nonprofit organizations doing so much to make a difference. We just need to continue to fly in a unified way together and not think that any one solution is an adequate solution, that any one approach is a sufficient approach, or any one organization is going to do this all by themselves.